ashver.com.
Hello, welcome to ashver.com. You are watching an interesting video about symptoms of a concussion. Hit your head hard. Please read the disclaimer carefully. Head injuries and concussions. Recently my son was assaulted and ended up with a head injury. It wasn't till a week later that he started to show the symptoms of a concussion. Never having had a concussion myself, I was prompted to share what I recently learned about the symptoms of a concussion to perhaps help someone else who has suffered a head injury. Although more frequent among athletes due to head injuries, concussions can also occur from any blow to the head, violent shaking or other head trauma. In my son's case, 1 week after the assault he started having blurry vision, slurred speech and a massive headache. Every time he laid down and got up he would get very dizzy, and upon examination his blood pressure would drop upon lying down. A CAT scan ruled out any bleeding in the brain, and the doctor said that he was showing classic symptoms of a concussion. Signs of a possible concussion. If you have taken a hard fall or hit your head, you will definitely want to look out for any of the following signs of a possible concussion: headache, nausea, dizziness or balance problems, double or fuzzy vision, sensitivity to light or noise, feeling slowed down, feeling foggy or not sharp, change in sleep pattern, concentration or memory problems, irritability, sadness, feeling more emotion. Head injuries can be life-threatening. If you have any doubt about the severity of a head injury, do not hesitate to get yourself to the nearest emergency room. They can do a full exam and a CAT scan to make sure you have no bleeding in your brain. It is much better to err on the side of an examination rather than lay down and perhaps not wake up. Several years ago my father fell off a ladder and within days had a very bad headache. My mother took him twice to the emergency room and they sent him home without x-rays, and said he was just suffering from one of his normal headaches. On the third trip my mother insisted that they do an x-ray. Thank God she did, because when the x-ray came back it showed that my dad had a subdural hematoma, bleeding in the brain, which required 2 brain surgeries. Had my father went home after that third trip, chances are he would have died and never got back to the hospital in time. Head injuries are nothing to play around with. If there is any indication that you may have injured your brain, get to an ER right away, and insist on x-rays and a full exam. Better safe than sorry. Receiving proper care for a head injury. Our brain is a vital organ for our body, and if injured, can cause repercussions for life. Although the symptoms of a concussion due to head injury do not necessarily mean life disability, they can lead to more serious problems. If you are diagnosed with the symptoms of a concussion, make sure you receive proper treatment and do proper follow-up with your physician. The good news is that our brain and our body have some amazing ways of healing itself. Sometimes all that is required is time, but as in all head injuries, close monitoring is critical, preferably by someone close to the patient to watch for any abnormal changes or behaviors. If you or someone you know has been diagnosed with the symptoms of a concussion, you will want to keep a close eye on that person for several weeks, to make sure there is no worsening of symptoms. Thank you for watching this video. This channel offers motivational, inspirational, valuable and informative videos to soothe, cleanse and inspire your health, mind, body and spirit. You can find lot of interesting videos on wide range of topics here. Stay tuned and keep watching.